Hepatitis B, HBV. Hepatitis B is a liver infection caused by the hepatitis B virus, HBV. HBV is one of 5 types of viral hepatitis. The others are hepatitis A, C, D, and E. Each is a different type of virus. And types B and C are most likely to become chronic. The Centers for Disease Control and Prevention, CDC, state that around 3,000 people in the United States die each year from complications caused by HBV. So, it's suspected that 1.4 million people in America have chronic HBV. HBV infection can be acute or chronic. Meanwhile, acute HBV causes symptoms to appear quickly in adults. Infants infected at birth rarely develop only acute HBV. Nearly all hepatitis B infections in infants go on to become chronic. Chronic HBV develops slowly. Symptoms may not be noticeable unless complications develop. Causes of hepatitis B. Hepatitis B is highly contagious. It spreads through contact with infected blood and certain other bodily fluids. Although the virus can be found in saliva, it's not spread through sharing utensils or kissing. In addition, it also doesn't spread through sneezing, coughing, or breastfeeding. Symptoms of HBV may not appear for 3 months after exposure and can last for 2 to 12 weeks. However, you are still contagious, even without symptoms. In particular, the virus can live outside the body for up to 7 days. Specifically, possible methods of transmission include intimate contact with a person with HBV, direct contact with infected blood, transfer from mother to baby during birth, oral, vaginal, and anal sex, being pricked with a contaminated needle, using a razor or any other personal item with remnants of infected fluid. Symptoms of hepatitis B. Symptoms of acute HBV may not be apparent for months. However, common symptoms include yellowing of the whites of the eyes, sclera, and skin, jaundice, abdominal discomfort, loss of appetite, fever, fatigue, dark urine, joint and muscle pain, weakness. Any symptoms of hepatitis B need urgent evaluation. Meanwhile, symptoms of acute HBV are worse in people over the age of 60. So, let your doctor know immediately if you have been exposed to hepatitis B. You may be able to prevent infection. Risk factors of hepatitis B. Certain groups are at particularly high risk of HBV infection. These include people who use IV drugs, those traveling to countries with a high incidence of HBV infection, people with multiple sex partners, people with chronic liver disease, healthcare workers, people with kidney disease, men who have sex with other men, people over the age of 60 with diabetes. Complications of hepatitis B. Specifically, complications of having chronic hepatitis B include liver failure, hepatitis D infection, liver scarring, cirrhosis, liver cancer, death. Hepatitis D infection can only occur in people with HBV. Also, hepatitis D is uncommon in the United States but can also lead to chronic liver disease. Diagnosis of hepatitis B. Doctors can usually diagnose hepatitis B with blood tests. In particular, screening for HBV may be recommended for individuals who have come in contact with someone with HBV, use IV drugs, have traveled to a country where HBV is common, are pregnant, have been in jail, receive kidney dialysis, have HIV, are men who have sex with men. Treatments for hepatitis B. Hepatitis B vaccination and immune globulin. Talk to your doctor immediately when you think you have been exposed to HBV within the last 24 hours. In particular, if you have not been vaccinated, it may be possible to prevent infection by to greater than receiving the hepatitis B vaccine and an injection of HBV immune globulin. This is a solution of antibodies that work against HBV. Treatment options for hepatitis B. Acute HBV usually doesn't require treatment. Most people will overcome an acute infection on their own. However, rest and hydration will help you recover. Antiviral medications are used to treat chronic hepatitis B. These help you fight the virus. In addition, they may also reduce the risk of future liver complications. You may need a liver transplant if HBV has severely damaged your liver. A liver transplant means a surgeon will remove your liver and replace it with a donor liver. Most donor livers come from deceased donors. Way to prevent hepatitis B. The hepatitis B vaccine is the best way to prevent infection. Vaccination is highly recommended. On the other hand, it takes 3 vaccines to complete the series. The following groups should receive the hepatitis B vaccine. All infants, at the time of birth. People whose work brings them into contact with blood. Family members of those with HBV. Any children and adolescents who weren't vaccinated at birth. People living in institutional settings. Adults being treated for a sexually transmitted infection. HIV-positive individuals. Men who have sex with men. People with multiple sexual partners. Injection drug users. Individuals with chronic diseases. People traveling to areas with high rates of hepatitis B. In other words, just about everyone should receive the hepatitis B vaccine. It's a relatively inexpensive and very safe vaccine. There are also other ways to reduce your risk of HBV infection. You should always ask sexual partners to get tested for hepatitis B. Use a condom or dental dam when having anal, vaginal, or oral sex. Avoid drug use. In particular, if you're traveling internationally. Check to see if your destination has a high incidence of hepatitis B. And make sure you are fully vaccinated prior to travel. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.